week, the COVID-19 vaccination program kicked off to a great start. We visited some of the parishes in the Western region to get a first-hand view of the process. We also visited the recently completed field hospital in Falmouth. Stay with us. It promises to be quite the experience. Frontline workers in Western Jamaica have been going out in large numbers to receive the first of 2 jabs of the COVID-19 vaccine. Doctors, nurses, community health aides and pharmacists were among the first group to be inoculated, and they are expressing gratitude and encouraging Jamaicans to go out and take the vaccine.
I'm glad to be here today to be among the first set of persons to be inoculated. Well, I'm feeling alright. It was a seamless process, and I would encourage everyone else to come out and get vaccinated as soon as possible, as soon as it's offered to you.
Personally, I'm excited. We're very happy because now we're looking at something that is a concrete way in which we're looking at a measure that can actually stem COVID-19. And certainly sometimes I know there has been discussion in terms of which vaccine is available and so forth. And of course the AstraZeneca is available to us. And when we look at it, if persons now are willing to take the vaccine, healthcare workers included, then we can look at protection of our population.
I am feeling very elated knowing that I was able to honor my commitment. Initially, during the pandemic, I had said, I'm on record saying that whenever a vaccine became available, I was going to be the first person to take it. And so I decided to be the first person at the South Health Center to have received the AstraZeneca vaccine. And I have since taken the vaccine, I have not felt any way different, apart from little aches in my knee. But outside of that, I am fit and I've been working subsequent to taking the vaccine.
I took my COVID vaccine and I wasn't hesitant because taking a vaccine means protecting myself and my family from COVID. And it has been 24 hours since I've taken it, and there is no side effects. I don't have any regrets, and I encourage all the other CHAs from Westmoreland to take their vaccines. Help to protect our nation and our families.
Individuals vaccinated will be ready for their second dose in another 8 to 12 weeks. In the meantime, they are encouraged to continue to follow the protocols as outlined by the Ministry of Health and Wellness.
We are really pleased and we thank the citizens for embracing this new weapon that we have against COVID-19, and we encourage them to not forget to wear the mask and do the other protocol, but let us combine efforts and use multiple modalities to decrease our deaths, decrease our hospitalization, and to keep our citizens in optimal health.
And finally, in addition to vaccination commencing, the fight against COVID-19 in the Western region received a further major boost with the recent completion of the Falmouth Field Hospital. The 36-bed facility, which will host patients suffering from the virus, is expected to offset the burden currently being faced by other hospitals in the region.
Today I can report that we are finished. The team has put in all the infrastructure. It's a very timely delivery of this asset, because what it means is that we now have 36 additional beds to add to this Western region. Already the hospitals here are at capacity, with Cornwall Regional over 130% for COVID bed occupation. So we have the building, we have the equipment, thanks to support from PAHO, all new equipment, nothing here used, and we have the personnel. And when you combine all of those together, what you have therefore is a ward that's ready to be utilized.
The facility is one of 4 field hospitals being established across the island to provide 152 additional bed spaces to facilitate the treatment of persons with COVID-19. That's all for the program today. As usual, thanks for joining us for Western Roundup, where we take you from the corners of St. Elizabeth to the hilly terrains of St. Anne. Remember to send us your feedback to gismabe@gis.gov.jm. Until next time, stay safe.